Hello, I'm Mike Paulus. I'm president at Sequentia, and I'm here to talk to you about our key bullet points that we use to help you create an elevator pitch or an initial conversation presentation with a target prospect, whether that's a hospital individual or anyone else that you may be talking to Sequentia about for the first time. We've created these 15 bullet points that I'm going to walk through for your use. Obviously, we understand that nobody uses each and every one of them, but knowing them and the points that you can relate to within these key bullet points, I believe will help you craft your own version of how you initially speak to a prospect about Sequentia. So I'm going to go through these and elaborate on each one of them for you. We start off with a definition of Sequentia's platform solution as a transition of care solution that optimizes the entire care transition process. Our focal point from the beginning has been to keep the patient at the center of this so that they get the best possible post-acute care provider for them, for their needs, their personal needs, and particularly their clinical needs when they are transitioned out of a hospital and into post-acute care of any type. And our platform solution we have created so that it looks at each and every part of this entire transition of care process from beginning to end and helps improve that across the board. Our mantra from day one has been sooner, faster, and better. Start this process sooner, as soon as possible, and we literally now can start that at the beginning of the admission process. Do it faster, accelerate the process through so that the patient ultimately gets a better choice, because at the end of the day, the patient does make the selection of the post-acute care provider that they go to. Second bullet point is that we do this more efficiently, less expensively, and help drive better care outcomes. And we do that by having taken the process totally online, utilizing existing patient data, but only select patient data. And we eliminate many of the points that had been points of disconnect in either limited software solutions or traditional manual paper, fax, and phone solutions for referring a patient out, discharging them, and getting them admitted into post-acute care. So again, our entire mantra, sooner, faster, and better, applies here. Do it more efficiently, do it less expensively, and create a better patient care outcome. Another thing that we do is we look at helping, starting with the hospitals, but also looking at the post-acute care providers, ways that a transition of care solution can help them improve those patient care outcomes by having a better care plan, a more carefully and better managed care plan, and a care pathway taking a patient from hospital into post-acute care. We also have looked carefully at the financial implications of what's impacting hospitals in particular today, and we help them optimize length of stay, which is a mandated protocol based on diagnosis code, and we help them then decrease readmissions, particularly the 30-day readmissions, and protect their CMS reimbursements for those readmissions. If a hospital brings a patient back within a 30-day window, they lose reimbursements, and as their readmissions climb, they begin to suffer penalties, which are in place today in the regulatory environment for healthcare. We talk about Sequentia being a holistic cloud-based solution. And again, as we looked at the need and the opportunity in the marketplace, we wanted a holistic solution that put everybody involved under the umbrella of Sequentia. And that's the hospital providing acute care at the front end, post-acute care providers of any type at the back end, and the patient in the middle of that entire process. We are agnostic. We have been developed to be agnostic to any type of hospital EHR or EMR, and those are their electronic health record or electronic medical record systems. those two terms can be used interchangeably. And basically what we're doing is tapping into the patient data, but only select patient data in the hospital's EHR. And or we can also tap into their ADT system, admissions, discharge, and transfer. And that is a secondary system that supports their EHR. And in some cases, we can draw most of what we need from that solution as well, or in lieu of tapping into the electronic health record system. We enhance the clinical care pathway by identifying what a patient needs early on in the process, and also through our predictive analytics capabilities, looking at those post-acute care provider specifically for an individual patient and identifying those post-acute care providers who do it best and most cost effectively. And again, what we're looking at is the entire care pathway that starts with the hospital and ends with a patient going into post-acute care, whether that is a skilled nursing facility, a rehab unit, home health care, or any other type of post-acute care provider. And we talk about our system being truly bookended end-to-end for the patient episode of care. And we literally start up to 3 days prior to hospital admission. When a patient is admitted to the hospital, there is a process that can be up to 3 days for them to go through that admission process. When a hospital user engages Sequentia at that point, we begin to collect patient data that will ultimately be needed for that patient to be risk assessed, create a readmission forecast for that patient, and obviously move them downstream through their stay at the hospital and then eventually into discharge. We also cover up to 90 days post-acute care because that, and we've built our system because that is what the government is looking at, and that's what CMS, Centers for Medicare and Medicaid, are looking at as the episode of care payment. One thing that you will hear us speak to frequently is the change in payment from the traditional fee-for-service structure that hospitals had to now bundled care payments, which are emerging and coming into play for the providers. Those bundled care payments look at the entire episode of care cost and payment. Therefore, that's what we look at to support with the Sequentia transition of care solution. A critical component of what we are able to do and what we've proven that we have done is that we can help a hospital define, develop, and manage a preferred network of post-acute care providers based on actual quantifiable data, their clinical performance, and their cost. We have literally a database that includes all post-acute care providers, and we can make assessments on behalf of a hospital in a specific location and look at their post-acute care provider network and identify those that they should be focused on and working with, who will provide the best patient care outcomes. As a quick example to define this point a little bit further, with our beta at Cleveland Clinic Hospital, we started with a 35-member group of post-acute care providers. Through our beta test and pilot program, we narrowed that down to the 15 best providers who best supported the hospital in their patient care. And today, rather than pushing out to 30 and hoping for the best, they now push out to 15 and get the best possible care outcomes. We also, again, from a holistic standpoint, we engage the patient and provide tools and a system for the hospital users, typically the care management staff, to do a better job of engaging the patient and ensuring that the patient is satisfied, not only with their stay in the hospital and the care that they received, but also in the discharge and movement of transition out into post-acute care. There is a patient satisfaction survey that is federally mandated and driven by CMS. It's called the HCAHPS Patient Satisfaction Scoring Program. Patients are typically surveyed upon or following discharge from hospital, and they will give better patient scores if they've had a successful and pleasurable transition process out through discharge. If their care had been great and the discharge process was miserable, they will typically give a lower or a negative patient satisfaction score. So we help hospitals engage the patients better through our tool and also help them therefore achieve better patient satisfaction scores. Back to sooner, faster, and better. We improve workflow regardless of what the hospital had been doing prior to our engagement, whether they were using the old school paper, fax, and phone system, or if they were using a less than completely efficient software tool in combination with that. We improve that workflow and we improve it dramatically. We have demonstrated that we can take literally hours off that referral process, and those are hours then that the care management staff can have back to use however they choose to see fit. We obviously push them, use that time to do a better patient engagement effort, and literally identify the post-acute care providers that are potential for a patient and show them that information. We literally can have them show that to them in a patient's room via a tablet or a laptop, or patients can also, their family members and themselves, get online and take a look at what their choices are. And we monitor, track, and report on all of the activities in that workflow so that the hospital users can better manage that, and also the post-acute care providers on their end can better manage what they're doing. A couple of the critical financial impacts that we have is we reduce wasted length of stay. Length of stay is the prescribed amount of time that the patient by diagnosis can be in the hospital. And what we really say today is that we optimize length of stay. The hospital may choose to keep a patient a little bit longer to avoid a 30-day readmit if that's to their benefit, or they can get the patient out on time according to length of stay and not lose the lost reimbursement dollars that come by keeping a patient too long. So again, we talk about optimizing that process, but by giving them information sooner and by giving them data, they can actually understand what their choices are. Significantly, we help them reduce their 30-day readmissions, one, by creating the risk assessment readmission forecast to identify those patients most likely to be readmitted, and also to identify the best post-acute care clinical pathway so that that further helps reduce a 30-day readmission. And we can do this, and we look at the existing ICD-9 codes that have been in play. Now that ICD-10 diagnosis codes are either in place or coming into place in hospitals, we track by those numbers and help hospitals understand which of their areas are impacting them the most and how they can better deal with a post-acute care provider who is best at a particular diagnosis code or diagnosis code group. We have gone through, there is the Office of the National Coordinator, another one of the federal agencies that has oversight over healthcare. We have gone through the ONC testing and certification process, which allows us to be an ONC Health Information Technology certified provider. We meet the meaningful use stage 2 transition of care module requirement. All hospitals are subject to meaningful use. For those of you who are not that familiar with it, meaningful use stage 1 pretty simply said that hospitals must have an electronic health record system and must make it work. When they moved into meaningful use stage 2, which for some hospitals is still in process, for others they have gone through and completed stage 2, there were over a dozen core requirements in there, one of which was the transition of care module. And that, so you understand, means really two things. One, they have to transition half of their discharges via electronic means. So rather than any paper-based referrals out, they have to do half of them electronically, if not all of them electronically. So we help them satisfy that. The other thing in relation to meaningful use stage 2, transition of care module, the government created a templated form called the CCDA, which is a document that we are capable of producing to meet the specifications of the federal mandate. We also can get that document if it's already being created in the hospital's EHR system, and an EHR is something like Epic or Meditech or Cerner. We can pull that CCDA and parse out the data that's in there and use that for our process in patient discharge, patient referral, and patient admission into post-acute care. And one of the things that we do, and again, the holistic viewpoint was to connect fully underneath our umbrella all three groups of participants in care transition. It starts with the hospitals who are providing acute care. The patients are in the middle, they are receiving care and going to be transitioned. And at the back end of the process, the post-acute care providers. We have done this in a way, again, to simplify it, to accelerate it, and to make sure we are providing all of the information that each one of those groups needs in order to make the best decision and in order for the care outcome to be the best possible outcome. And so that's one thing that we use to differentiate ourselves and also to help hospitals understand we are helping them leverage tools and systems that they may already have. We are simply making them better. We are connecting with and taking specific information from their EHR to move it from a passive state into an active state in that entire transition of care process and post-acute care value chain as they make their decisions on what they do with their patients and how they help move their patients along. We include any and every type of hospital at the front end. I will tell you that for those of you who are looking at hospitals, a hospital with less than 75 beds and typically an acute care hospital, critical access hospital, which has typically 25 to 50 beds, is not really a great target for us. But any hospital more than 75 beds and then onward and upward is a good hospital target for us. Obviously, they have an EHR. We need to understand that EHR so we understand the interface that we need to create for that. And again, I will reiterate, we are agnostic to EHR. It doesn't matter to us which system it is. We can interface with it. And then also we include any and all types of post-acute care providers, from skilled nursing all the way through hospice, and that would include home health, rehabilitation, mental health, drug and alcohol, literally any type of post-acute care setting. I will tell you that the vast majority of our focal points with the hospitals we're dealing with are moving patients into skilled nursing and rehab or in-home health care because that's where they have the most exposure from a cost standpoint, and that's where the majority of their patients are going. So we pay particular attention to that. And one thing that we do that literally no one else does is that we have a fully consumer accessible portal that when we work with a hospital, we identify each and every one of the post-acute care providers that they include in their geographic range. And Most often that is anywhere upwards of 30 miles in a radius from the hospital, but we can go beyond that. We can go as far as they want. We literally connect each and every one of the post-acute care providers into the system. We help create a profile for each and every one of them by understanding what their offering is in terms of clinical services, the care that they provide, as well as their personal services and amenities. And we build an active online profile for each one of them, starting with our template, but also collecting things like their photo galleries and videos and website links and descriptions of them. And what we help the hospital do is narrow down their preferred providers so that, one, we have a complete list of everyone they want in that mix, so they do provide patient choice fully, but also that we help them focus on the primary post-acute care providers that they want to move patients to, again, to get the better, most cost-effective patient care outcomes with the process. And finally, one of the things that we do, again, sooner, faster, better. That is our mantra literally from the start of this system. And what we do is predict and alert the hospital team about a patient at high risk for readmission, the need for a better, more specialized care plan, and a more specialized care pathway. And we literally start this process within 8 hours of admission into a hospital on behalf of the patient. So we are immediately tapping into that patient's record. We are immediately looking at and making assessment of that patient's condition. We are looking at their likelihood for readmission. That pushes alerts downstream to the care providers involved and the care management team. And then ultimately it pushes into those people who are helping the patient and the patient family members make a selection of a post-acute care provider. And again, when they're armed with detailed information and visible information about those providers, they're going to make a much better, more informed decision. So those are the bullet points. Again, we hope that helps you with your conversations with your target prospects. We are delighted to field any questions from you and provide any support that we can for you as you go through this process. So please reach out to Jerry, myself, and any of the other members of the Sequentia team if and as you have questions about your own personal pitch about Sequentia. So thank you for your time and interest. We look forward to continuing a connection with you as we go forward with this. Thanks, and have a great day.